Good afternoon. Welcome to Marshall Browning Hospital. It's a very exciting time for us. We've never had an event like this before. We didn't hesitate when it was offered. It's a very important topic, and I appreciate the governor's willingness to listen to us and find out what our concerns are, and there are a lot. You know, I've been around here 45 years associated with the hospital, and yeah, I am crazy. But the hospital's been 100 years, and it's the first time we had an event like this. And I don't know why it took us so long, but here we are. I'm so glad to do this. And Governor, your interest in this big, beautiful bill is appreciated, because it's definitely going to impact us, everybody. And what I find it be, I will probably say this later, but it's not only healthcare, but it's economy. You know, what if our payroll goes away? What if the hospital closes? Where do those people find jobs? So it's very important. And again, I thank you all for coming, and I thank the governor for making himself available for this. I know he wants to go to the parade and the fair tonight, but it all works out, so that's good planning. So with that, I'll turn it over to Governor Pritzker.
Thank you very much. And thank you very much. Thank you not only for the very kind introduction, but also your leadership here, to all the staff and healthcare workers and the people who depend upon this hospital. Thank you. You've been heroes in so many ways, and we owe you a great deal beyond just fighting for you in the current moment. So again, wanted to express my appreciation. I want to thank everybody for joining us, and especially for folks lending their expertise to what is really a vital conversation, especially at this moment. Rural hospitals, you all know more than anybody, are a critical lifeline for this entire region. Not only are they often the only providers of life-saving medical care for, miles around there, also critically important, as Dan is implying, to the economy of the area and to jobs. And they are, hospitals like this one are working with razor-thin margins, and Medicaid has always been a vital federal program that enables rural hospitals to survive, and we need them to survive. They are providing healthcare in deserts, at least areas that otherwise would be deserts. So the administrators, the frontline providers, the doctors, nurses, support staff, dedicate your lives to the health and welfare of the people of this region, and especially to the patients. And it's because I think, like so many others who are in a kind of frontline field, it's because you care. It's because you decided to go into this kind of work because you want to care for the community, you want to care for people, and uplift them, and that is what we ought to be helping enable. So instead of helping the heroes out, though, and I don't want to be too hyper political, but we're talking about policy here and the impact of it. The Congress has decided to cut Medicaid, putting virtually every rural hospital at risk in some fashion or another, and it's dangerous. It is really dangerous. Communities can lose their hospitals. Indeed, some will. I can guarantee that if this bill stays as it is, and it is what it is. Patients are going to lose care. Doctors and nurses are going to lose jobs, and the staff, and people will die. And I don't say that lightly. I've said that a couple of times since the bill was introduced, and I thought perhaps that sounding the alarm would stop it from happening, or at least slow it down. It didn't. And so there are going to be people who suffer mightily, and families that lose a loved one, and people who will die. And it's all because they want to provide a massive tax cut for the wealthiest people in the country. I don't understand the thinking. So I won't go further into that except to say that it's wrong. These cuts are going to be devastating for rural healthcare throughout the state of Illinois. Medicare and Medicaid are the primary players for hospitals and for providers, especially in rural areas. In fact, 73.7% of patients admitted to rural hospitals are providing this kind of support for hospitals, Medicare and Medicaid. It comes with those patients. 61.6 are small rural outpatient providers. Much of that is going to be lost. 500,000 rural Illinoisans are currently on Medicaid. That may not, I don't know if everybody's got a feel about what that means, but there are about 3.3 or 3.4 million people on Medicaid in the state of Illinois. We have about 13 million people in population. 500,000 is an enormous number, I mean, by any measure, but it's a very large percentage, and it is especially impactful here. Medicaid spending in the state's rural areas is expected to decrease as a result of this, just in this state, by $6.4 billion. There are other calculations that add on the ancillary effect, so don't grab onto only that number, but just know how these are huge numbers. 9 rural hospitals in Illinois are now basically identified and targeted as likely to close if we are not able to figure something out for some of them as a direct result of Trump's budget bill. And even if they don't close, just to emphasize this, even the hospital that doesn't close is going to have to make cuts. It's just inevitable. And if I sound pessimistic, well, frankly, it's because at the moment I am, but I'm here in part because I really want to hear what you think we should be doing. I mean, if we can't change the bill, what is it that we should be doing? Because there isn't any money laying around. And the state government definitely doesn't have $6 billion to distribute to hospitals or providers. So, so I'm very interested to hear what you have to say. It's going to be devastating for people's health, for the safety of residents. People are going to have to travel a long way. I don't need to tell you that, but there are some areas where it's literally, I mean, people are going to die on the way to the hospital because their local provider closed. And of course, the local economy is going to be hurt terribly. The 9 hospitals that we're talking about account for about 11% of the rural inpatient hospitals in the state, and 500 inpatient beds for rural Illinois residents. And then these hospitals collectively employ over 2,500 people, and we will see job losses. Right here in Perry County, about a quarter of residents count on Medicaid. That is how they get their health care. So make no mistake, just to be clear, and it does sound awful pessimistic, but I want to say state government is going to work really hard to mitigate the damage that's being done and the cuts that are coming. And I think I'm going to hear other people double down on what I'm about to say. We just can't replace what the federal government is providing. They're just much bigger. They have a printing press where they can print money, and I'm not suggesting they should always be doing that, but I'm also saying state government does not have that. We only have the resources that we collect every year, and frankly, we'd all like to see the taxes in the state lowered. And so when the federal government says we're going to take away what we provide, it leaves the state in a terrible bind, and we just can't replace it. So, okay, well, that is my pessimistic part of my talk. My optimistic part is that you all have ideas, you all have experience, you all have the kind of leadership that it's going to take for us to triage the damage that's being done, and I really want to help figure out how we work together to make all that happen. So I'm going to turn it over to AJ Wilhelmi, who's the leader of the Illinois Health and Hospital Association, who's going to lead a conversation with all of us. So thanks all for being here.
Thank you, Governor, very much for your leadership, for being here to have this important conversation about this piece of legislation that was enacted on the 4th of July. Really look forward to the discussion. Also want to thank Dan Eves for hosting us today for this important conversation. And I think we've been on record for months now, certainly since the bill was enacted, that IHA and the Illinois hospital community have serious concerns with the federal Medicaid cuts that were enacted in this mega bill. The governor laid out many of the details and statistics that are troubling. When you think about the size and scope of the cuts, it is significant. And so when we think about Medicaid, we know it's more than a budget line item. It's a lifeline for many people that we serve as the hospital community who frankly have no other coverage options. And so when people lose their health care coverage, we know that they will continue to arrive at our hospitals. Our hospitals will continue to provide them with care, but without reimbursement now when folks lose their Medicaid coverage. And that is very troubling because hospitals are already stretched to the brink due to increased labor, drug, and supply costs coming out of COVID. So this increase in uncompensated care will put further pressure on hospitals and make it very difficult to maintain current service lines, as the governor said just a few minutes ago. And just want to put one point out there for everyone's consideration. We know that this law makes significant changes to provider taxes and state-directed payments. These changes are going to severely limit Illinois' ability to draw down federal Medicaid matching funds and greatly reduce Medicaid payments to hospitals. And for rural hospitals, the reduction in Medicaid reimbursements will force them to make very painful decisions, including cutting services and reducing staff. And as the governor said, some rural hospitals may be forced to close. And when a rural hospital closes, Dan said, the consequences ripple far beyond healthcare. And the governor said it as well. These hospitals are often the largest employers in their communities, so a hospital closure means that lost jobs and a major blow to local economies. And so that's a significant factor in this discussion. So as we'll discuss today, the One Big Beautiful Bill Act does include a $50 billion rural healthcare transformation program intended to support rural hospitals and providers. But I think we would all agree that when we're talking about $50 billion out of $1 trillion in cuts to Medicaid, that is woefully inadequate. Nevertheless, these funds are critically important to rural hospitals and providers in this room and across the state of Illinois. So IHA and our member hospitals serving communities in rural Illinois look forward to working with the Pritzker administration on an application to the federal government to bring this vital funding to our hospitals and providers. And let me close by saying that Illinois' rural hospitals and health centers are the backbone of their communities, but they are fragile and they need support. And that's why IHA is committed to being at the table, working with the governor and his administration and the legislature, and of course our members across rural communities in the state of Illinois to find opportunities to continue providing these critically important services and to see if we can get relief from this piece of legislation that's now the law of the land, working closely with our congressional delegation to either mitigate or further delay their effective date. So with that, as the governor said, I'm going to moderate a discussion, so let's get into that. I'll be presenting questions to our panel of government and healthcare leaders, and I want to start with Dr. Samir Vora, the director of the Illinois Department of Public Health. Director, it's good to see you again. So as the state's top public health official, let me ask you this. How will the cuts enacted by the BBB impact rural healthcare providers broadly?
Thanks, AJ, for the question. Thank you, Governor, for your leadership. Dan, thanks so much for the invitation. AJ, I think the simple answer to your question is it'll affect it a lot and in many deep ways. I, in this job under the governor's leadership, have the privilege of traveling across our 102 counties in this state. And a lot of those conversations come in small rural communities. Immediately before this, I had the opportunity to work at Southern Illinois University School of Medicine, traveling, meeting with rural hospital CEOs. And as we've mentioned, rural hospitals are the backbones of these communities, but they're really anchor organizations. It is often the place that the hospital brings the community opportunity that in some ways is truly unique, even more so now. We also know that unfortunately our rural communities here in Illinois and across the country are often sicker and older. And we often talk about the 5 Ds, that rural communities fit in a little bit of a disadvantage. That's because of these deserts of services. And we talk about healthcare services, but there are a lot of services that relate to what makes a community healthy. There's also disconnection. Yes, we're in a tech world where connection matters, and even more so in the way that healthcare is being really connected in new and different ways, but the connection often to specialists and other items that are there. And that leads to disparities that we know exist in our urban communities as well, but often magnified. And those last D, the developmental opportunities, simply aren't there. And so what now we're facing is that already, as the governor mentioned, we have 510,000 rural Illinoisans on Medicaid. Nearly 15% of all Medicaid recipients, and Dana Kelly here as Chief of Staff of the Department of Healthcare and Family Services will go into that in even more detail. But it also means that we experience primary care professional shortage areas, mental health professional shortage areas, dental care professional shortage areas. And Medicaid is often a unique funder for those communities. This work done out of the Illinois Department of Public Health's Center on Rural Health, seeing Kristen Nolan in the audience, and works very closely with the Illinois Health and Hospital Association, the Illinois Critical Access Network, and critical access hospitals across the state. And into that, the One Big Beautiful Bill isn't moving to a place where we're investing more into building up the real innovation that happens in our rural communities, because I know from meeting so many rural hospital CEOs like Dan here, John, from our rural clinic leaders like Kim, often our rural leaders know that they gotta pull their sleeves up and figure out how to deal with complicated issues. And they're up for deep and significant challenges. But what this One Big Beautiful Bill Act does is it takes and pulls the rug out from under them. It doesn't provide the foundation that is absolutely necessary to be able to move up, to be innovative, and to think about these things. So that anchor organization, as you mentioned, means jobs, and it means a lot of just critical service lines. It means the ability to access primary care. It means the connectivity that's required between our healthcare system and how it looks. And unfortunately, we're at a place where, as Governor, as you said, it will really create challenge that we're ready to fight and work together, but it's a place that we're gonna have to work from a deficit. We often talk about in public health this idea of harm reduction. And part of it sometimes is to call out that harm is actually happening. And this bill is causing harm. And so how do we reduce that harm? How do we work together? How do we think differently and innovatively? And I know that our partners in this room, our partners across the state, we want you to all know that the Illinois Department of Public Health is your partner, wants to work with you collectively. We're gonna need ideas, but there is great power in this partnership, and we look forward to working on solutions together.
Thank you, Doctor. Great comments. Innovation, creativity, partnership, all going to be very important as we go forward. Dana Kelly, Chief of Staff at the Illinois Department of Healthcare and Family Services. Good afternoon. Let me ask you this. How will rural Illinoisans' access to healthcare coverage change as a result of the big, beautiful bill?
Thank you, AJ, and it's an honor to be here with you, Governor, as well as thank you so much, Dan, for hosting us. So I'm Dana Kelly. I'm Chief of Staff at HFS, which is Healthcare and Family Services in Illinois. We administer Medicaid. We have the tremendous responsibility of administering Medicaid and taking the front of what is going to be an enormous challenge to navigate these changes. As it was said before, there are 500,000 Illinoisans in rural areas that are on Medicaid. We know that's out of about 3.5 million. With the work requirements alone that are going to be instituted under the Act, we are estimating around 300,000 Illinoisans would potentially lose care. We don't know exactly how many of those will be in rural areas, but I want to paint a picture for you for that 25% in this county. Just those are your neighbors. So think about 1 in 4 of your friends are on Medicaid. Starting in potentially October of 2027, they're going to have to go in on a monthly basis into a system, upload whatever checklist documentation, but potentially upload documents, including payroll records. It's unknown exactly how this is going to be administered, but some have likened it to having to do a monthly income tax return. So if you can imagine that level of burden that people are going to be experiencing in rural areas where honestly, I mean, technology is an issue because based on investment, but even broadband can be limited in some rural areas. And the ability for caseworkers who we rely on heavily to work with people on Medicaid to enroll them, it's longer to travel. The lines may be longer. There's maybe fewer staff in those offices. I think that rural areas have an enormous challenge, both from the technology front and just from the access front. It's just another healthcare access point they're going to have to travel to or seek out that every single month to maintain coverage. So that's just to paint a picture of how dangerous just the coverage requirements are going to be for rural hospitals, health centers. It's not just hospitals. We're talking our community mental health centers, our substance use disorder clinics, all rely on Medicaid to provide coverage. And then I'd be remiss to not speak about some of the provider tax and the other large financial cuts that are being made to Medicaid, because that's the way that we can maintain Medicaid providers in our system. We know in rural areas, access is already an issue. Volume for providers in rural areas is already an issue, making it very difficult and the margins on providing care, especially to high Medicaid populations, very difficult. And those are only going to exacerbate when we have fewer funds that we can give out in the form of reimbursement, in the form of other payments that supplement good behavior, good activities, including OB care, graduate medical education, and things like that. So, I mean, these are communities that are already facing higher maternal mortality in areas. Rural areas is much higher in rural areas than in metro areas. Poverty rates and unemployment in Illinois is statistically speaking higher in rural areas than in our metro regions. And rural residents are already more likely to perish from some of the top 5 leading causes of death, including heart disease, cancer, unintentional injuries, chronic lower respiratory disease, and stroke. So we are very vulnerable, and we spoke about these 9 hospitals that are already, on the brink. So I'm doing a good job of painting the very sad picture. I will lift this up a little bit to talk about what HFS is doing, however, to really we have an opportunity right now. The $50 billion that's being distributed by the federal government is a drop in the bucket of the need, but we're going to leverage it. And what we're doing right now is we are going across the state, talking with stakeholders at this table. We're talking with our legislators. We are going to be holding a listening session, which all of you will get an invite to soon. It'll be in early September, to really hear broadly from the community about what the rural health concerns are in the state of Illinois. And we're also going to have open up a portal on our website where people can submit written comments. If you don't like to be your face in front of a Zoom camera, we're happy to collect that. But we want to hear from you, because we know that the rural health population in this state deserves as much chance at innovating around this problem as possible. And we're going to work to get these funds to do anything we can to reduce some of the barriers like technology, transportation, proximity to partners, and really focus on some of the key areas where we know that we can promote prevention of chronic disease, workforce development, equitable access to healthcare, and innovate technological innovation. So more to come. It's going to be a lot of work from us, but I welcome you all to come to me here, and please, I'll take your card. We can have a conversation about what it is that we can do in the state of Illinois to really try to make the best of a very, very, very challenging situation.
Yeah, very well said. Thanks, Dana. We look forward to partnering with you on that $50 billion rural healthcare transformation program.
Mind if I just add one thing that I heard both of you talk about, the $50 billion fund, and I don't want anybody to misunderstand. AJ started to put it in context, but just so you know, because it sounds like, wow, there's a lot of money out there, we can go get it. We're talking about $150 billion of cuts to rural hospitals, 150 that they've done. And then they created a $50 billion fund that's going to require the approval, much of it, by the leader of CMS, right? And so basically they've taken, instead of it automatic, 150 billion down to 50 billion. And they get to decide who's getting it, not the users, the patients who are showing up in need of help. And then that's just a drop in the bucket of the cuts overall to the healthcare system that they put in place, which is $1 trillion. So 50 billion, I mean, it sounds great, but they literally are cutting $100 billion to start with if you just net the two. And then it's out of really $1 trillion of cuts. So anyway, listen, we're going to go aggressively after the $50 billion. We hope all of it comes to the state of Illinois, but it's not going to, and we're going to get as much as we possibly can, but it's going to, again, be just a very small sliver of the damage that's being done. So, sorry.
No, really important context. Thank you, Governor. And all right, John Antese, President and CEO of Southern Illinois Healthcare. Good to see you, John. Thank you for being here. And let me ask you this, can you share some of the challenges facing rural hospitals and health systems like SIH, and how this piece of legislation that's now the law of the land will exacerbate some of these challenges?
I think you've heard it. We really don't have any challenges that we have to rise up to. No, it is interesting. Running a rural hospital is very challenging. Whether it's the economics of it, whether it's finding the staff, whether it's keeping up with technology, the cost of pharma, you name it, it's difficult. But I will say this, most of the hospital administrators I know that run rural hospitals, they have smiles on their faces. Will Norwood does. He hasn't had one since he sat down there, but he usually has a smile on his face. And I do believe it's because they work with people that believe in what they're doing, and they're there to take care of people that live in their community. And that's why they went to nursing school, that's why they went to pharmacy school, that's why they decided to become a doctor. And so we get to work with people that are doing God's work. And we have to try the best to support them in the best way we can, which is getting a lot harder. So the OBBA, let's make no bones about it, it's gonna cut. It's actually $1 trillion cut to healthcare. $1 trillion cut to healthcare. We're only 150 billion of that, but that's a big chunk for us. When I think about our organizations, so rural hospitals by nature take a disproportionate share of uninsured and Medicaid patients. Those uninsured Medicaid, and as you know, just off their base rates, we lose money on. We lose money on Medicare as well. So the only patients that we make a margin off of are commercial insurance, and that may be 1 out of 4 people. I don't know many businesses that can make money off of 1 sale and have it cover all 4 sales. So it's a hard business to do. When we think about the statistics in the neighborhood where we live, we just finished our community health needs assessment recently. Household income in Southern Illinois is about 30% less than what the average is across the state of Illinois. Poverty rates in Illinois are like at 17.5%. That's 40% above the average across the state of Illinois. We have a population of around 19% of our population has a disability. That's 45% above the average across Illinois. Guess who is the most complicated patient to take care of? A dual eligible, somebody that's on Medicaid and on Medicare because of a disability. They cost more money than any other patient you'll see. And we see a lot of those. So when we think about the implementation of this, there's multiple ways in how it's gonna come to the hospitals, and what's gonna happen as far as dollars. We will lose people off of our insured rosters. Both Medicaid, and what we haven't talked about, those that aren't Medicaid, they're buying in through the market. Because the subsidies for people to buy commercial insurance through the market are going away. So we will see through the changes to the requirements to be in Medicaid, and then the pullback of the subsidies, we will see our uninsured go up. Our calculation is right now, we're sitting at about 7.5% uninsured. That's gonna go up somewhere probably around 11% or north of that. That means more than 1 in every 10 people coming in the door will now be uninsured. We don't get anything for that. What we used to get for that was these dollars that we were talking about in the hospital tax and in the state-directed payments. One of the ways we neutralize some of the differences between hospitals that have really good payer mixes, so they're seeing 50% of their patients for commercial insurance type of a thing. We all pay a tax in. We send that money, we pay the tax into the state, and it goes to the federal government, and they provide matching money on it. And that matching money, when it comes back, gets redistributed to the people, the hospitals that are serving predominantly Medicaid populations. And that's how those hospitals stay alive and open. Without that, they won't be open. And that is getting cut severely. Right now, our tax is at 6%. It's gonna go down to 3.5% over time. And the max payment out of it will be Medicare rates. So maybe more than Medicaid rates, but it still is gonna put us at a losing point. Because remember, I said we don't make money off of Medicare. We lose money. So between having more people that are uninsured and having that tax go away by and large, it's gonna hit hospitals hard, really hard. Now, the positive thing I would say, it's positive, there's a delay in this being implemented. It doesn't start really, we don't see our first cut until 2027. So we have time to try to work this back. We have time to try to come up with something that is reasonable and that makes sense, that won't let a lot of hospitals collapse over the time period. I hope we can do that. They did that back in the late 1990s, for those of you that have been around as long as I have. Newt Gingrich and Bill Clinton got into a spat, they shut the government down. They were able to get it open, but they got it open by taking a huge cut out of Medicare. Within about 3 years, they put that money back in because they realized how bad they damaged the system. Hopefully, we don't have to put money back in. Hopefully, we can figure it out before it gets to that. I look forward to the work on the health transformation program. but I remain a little bit skeptical because of the way it's worded and put together. There doesn't even have to be a single dollar to spend on a rural hospital. It's all gonna be based on how we decide to put it together in Illinois. And somebody else will get to decide whether or not we get any money. So it's not a foregone conclusion. It's something we've gotta work hard and put together good proposals for to go in. And the other thing I would say is, don't think this is just the old DVBA. Right now, there's legislation that's still headed towards probably passing to pull back and change the 340B program. Now, for those of you that don't know what that is, that allows hospitals like ours to buy drugs at a lower rate than hospitals that have a really good payer mix. They're wanting to change that to a rebate mechanism. So right now, Big Pharma gets it, they have to discount their drugs. They don't like that very much. But it helps us be able to do things like the cancer center that we have. What it will turn into is a rebate program. I mean, we have to pay the full price and then fight with Big Pharma to get the money back. So we have to keep our eye not just on what what's happening already to us, but what could still happen to us before the end of the year.
Very well said, John, thank you. Added context, the provider cuts, provider tax cuts, and the state directed payment cuts, 1/3 of the $1 trillion that was taken out of healthcare by this bill. So, and we definitely need to continue to be vigilant. So appreciate that word as well. All right, Kim Matroka, local FQHC, great to see you. And I have a question for you. CRHPC provides care to residents across the Southern Illinois region, and I'd like you to speak to how cuts and other recent federal policy changes will affect access to care for rural Illinoisans and how your operations will be impacted by the potential loss of customers.
Thank you, AJ. So, as you stated, we are a federally qualified health center. We have 15 locations across Southern Illinois in about 9 different counties. We have about 300 employees. We have 70 healthcare providers in all of these small communities. We do receive a federal grant, but our federal grant only covers about 10% of our budget. Everything else is through billings for Medicare, Medicaid, private insurance, and private pay. Our staff are very dedicated to providing the best healthcare they possibly can. Most of them are from the local communities. Most of our providers were not recruited in from other states. They are mostly Illinoisans that grew up here and they really care about the people that they take care of. But with these cuts, we believe that we might potentially lose about 36% of our patients that are receiving Medicaid will no longer receive those benefits. And the reason that we believe that those numbers are fairly accurate are based on the expansion of Medicaid helped a lot of our patients in bringing them onto Medicaid that were not being currently served. But a lot of our patients are children. A lot of our patients are adults with disabilities. And then we have a lot of patients that are senior citizens that they are Medicare and Medicaid because they can't afford the secondary insurances that a lot of people are afforded that are on Medicare. I think what I really want to stress that bothers me about the community ideas about what they think Medicaid is not a cash benefit. It is health insurance. I've had a lot of people say to me, well, Medicaid patients are getting revenue. No, they are not. It is absolutely a health insurance program. And when they lose that health insurance, they're going to be reluctant to seek health care until they're very ill, and then they are going to show up in the emergency rooms. And the cost will be so much more significant than it would be if they'd come for preventive care. The things that rural families face are, there's lack of transportation in our areas. Yes, it's beautiful. For those of you that came south, we have beautiful countryside. But if you aren't able to drive and you don't have a car, there's very little transportation in terms of public transportation. And if you are a patient that has behavioral health care needs, any public transportation that is out there does not want to give transportation services to those people that have behavioral health care needs. And I think I'd be remiss in not saying that the next biggest outlier for our Medicaid population and our Medicare population is we have a food desert here. Yes, we're in the middle of farming areas. Look at these little towns around you. So many of them, they don't have a grocery store. They have no sources that are available to people that do not drive that provides them with fresh produce. So what are they eating? They're eating things that are not healthy for them. And this even makes our job that much harder to convince them that they need to be seeking healthier ways, to supplement their diets. Also, one of the services that we do provide is what John just talked about, was in 340B pharmacy. Christopher Rural Health Planning Corporation, we have our own pharmacy in-house. And through those 340B discounts that we get, we're able to pass along those discounts to our patients. But those discounts are much less now due to pharmacy cutbacks. But it does help us. If you can't supply the proper medication to patients, they're not going to get better. So it is so critical that we have those things. But all of these cuts, primarily with Medicaid, it's going to make a huge vacuum of services that get pulled away from our patients. So what we see, we believe that just at our health center alone, we're looking at probably ultimately about a $3.2 million loss if those patients lose services. Now, we're gonna be there for them. We're gonna provide health care to them as we always have, but we can only do so much if we're dealing with less income coming in.
Thanks very much, Kim. And again, important context, right? 36% of your patients, $3.2 million loss. And it's also important to remind folks what Medicaid is and what it isn't. It is a health insurance program for low-income individuals. And without that coverage, they don't have access to primary care and other critically important services and have to use the emergency department as their point of access. So well said. Anything you want to add, Governor? Our last speaker, our last panelist is Dr. Jennifer Rose. And so as a physician serving rural Illinoisans and an educator, what do you see on a day-to-day basis, Doctor, with respect to providing care? And how do you see the closure of facilities and the loss of healthcare coverage impacting rural communities?
So I'm another panelist that is very appreciative of being here and being included in this conversation. I don't know that I have anything to say that hasn't already been touched on, except as I'm sitting here listening to all these changes, I'm thinking about the patients that I care for and the people that I know, and wondering which one of them are not going to go get the care that they need. Because it's some of them. I don't know exactly who, but I know that some of my patients are not going to be able to get the care that they need. And so to answer the question, how does this impact? The only answer is profoundly, right? We know that access to care in rural areas is already limited. And as we lose this critical safety net of access across the region, we're gonna see that the patients in Southern Illinois have to drive further and wait longer to get primary care services, to see specialists, even to get life-saving emergency care. And that's going to profoundly bring down the health of our region. And those are only for those patients that have any support network to get any kind of care in the first place. And as an educator, I'm even more concerned because before this bill was ever conceptualized, HRSA identified that we didn't have enough physicians to meet the needs of Americans and projected that over the next decade, that supply of necessary healthcare providers and the demand of patients in the country will get wider and wider. And now we've thrown this into the mix, and it significantly threatens our ability to be able to fix that widening gap. I work with medical students
who have committed to training in rural areas and want to practice in rural areas. I myself grew up in Marion, Illinois, and I always wanted to practice in my community and serve the people that were part of my family and created my home. And I work with students that share that same dream. And as we lose providers in this region, not only do we lose the healthcare services that they're providing, we now also lose educators for the next generation of physicians. And this bill threatens the ability for students that had that same dream that I was able to realize, because it has significantly cut the support for federal student aid. You can no longer get the education to be a physician without access to private funding. And a lot of the kids like me didn't have that, right? We were bootstrapping to try to make ourselves and our communities better. And this act makes that impossible.
Very, very well said. You know, the word profound, right, carries a lot of weight, and you're right. The impact of this bill will be profound and very, very challenging, as everyone here has said. And your point is well taken about, you know, folks having to drive further, right, and wait longer, and what that will mean for outcomes. And of course, the funding cuts relative to the future physicians and clinicians in this state and this country, all very much in play. So thank you. Before I turn it back to the governor, I want to thank our distinguished panelists for sharing really important insights for all of us. This is an important conversation that I know, Governor, is not a one-time thing. We're going to continue to have this dialogue. So before I turn it back to the governor, I have two things to say. One, will you join me in a round of applause for our excellent panelists? And two, I want to echo comments that have been made already in thanking the governor for his extraordinary leadership, his deep passion and commitment to providing health care to the people of the state that he serves with distinction. We're very fortunate to have a governor who wants to hear from people and then take action based on that feedback. And so let's hear it for our governor, JB Pritzker. And Governor, back to you.
Thanks so much, AJ, and I don't want to prolong us much, but I want to just feed into something that Jennifer said, that the doctor said. I actually took a note before you said it, and I thought, oh, she just hit it, but I want to remind you, massive cuts in this BBB that basically will take away the ability for people to go to medical school who needed financial assistance. So in addition to all of the problems that we just described about hospitals and providers not getting paid for patients, and therefore some of them closing and jobs going away, and therefore, you know, people not entering the industry and not having what we need to provide the healthcare, we're going to have people choosing not to go into healthcare at all, not to become doctors in particular, when we need more, not fewer, because what they've essentially done is put a cap on the amount of financial assistance that you can. They've lowered the cap. There was a cap already. They've lowered it by a third and made it near impossible for someone going to medical school, which is a multi-year endeavor, and it's very expensive, right? More expensive than college, more expensive than other graduate degrees, et cetera. And it essentially hits doctors the most, what they've done. So think about all the other healthcare cuts that they've made, and then add on top of that, they've made it harder for anybody to enter the industry itself. So that is really dangerous for the future. Okay, that's enough bad news. What I want to say to all of you is, and you've heard across this panel that there's a lot of trouble ahead. But I also want you to know that literally every person that you have elected, and every person that is sitting on this panel, and every person that is in the healthcare field in a leadership position is trying to work through how are we going to manage to, and I use the word triage, but we are going to have to figure out how to deliver almost as much service, it won't be as much, but almost as much service to people, you know, at lower cost, and to make sure that we are addressing in particular the most vulnerable communities. And I hate to say, all across Southern Illinois is a most vulnerable community. And so that's not to leave out, trust me, I have met with hospitals in Chicago too, and I can tell you that they're gonna be damaged significantly by what's happening. But we already had healthcare deserts here. We already had service deserts for certain kinds of services. You're already having to travel quite a long way to get to a service provider, and now it's just doubling the challenge in areas where it already was challenging. So my optimism is that everybody, the best minds that we have, and frankly Illinois has the best minds on this topic, and the best minds are focused and attempting to work together to try to solve this problem, because what we want least of all is for the people of Illinois to have their health care, their personal health, their family's health diminished as a result of the federal government's, the damage that they're attempting to make. So we're on it, is all I can say. I think that's the optimism that I would provide, is we really are working hard, and it's not gonna be easy. And I especially want to applaud people who are running these large healthcare institutions, because they're the ones who are going to sit there with, and we do it at the state level too, but they're going to sit there with their budgets, thinking about how do we least affect the people that we're serving, and yet still somehow keep the hospital doors open and moving forward. And also I think that there is a backlash, I'll just say, going on right now. People are hearing from their constituents, because they're hearing what we're saying and they understand. Forget about a politician, elected official saying something to you. These are experts who are, Republicans and Democrats, all of whom are saying, this is going to be difficult. People in communities are speaking to their elected officials about what's going to happen. And I think some already are regretting, what they've done. My hope is that they'll do something about it before the end of the next year and a half. When we talk about it's happening in 2027, it's January of 2027, to be clear. So, how many months is that away? It's 17 months, something like that. It's not very long. So anyway, I am optimistic, because I do think that it cannot continue the way it has been, and that we have great people thinking about it. So thank you all for joining us. Thank you for the knowledge that you're imparting, and I look forward to working with people in the audience here, people that are up here, and so many others around the state to try to solve our problems.
Thank you very much, Governor. All right, that's the end of our discussion. Thank you all for being here, and have a safe weekend. Thanks again, Dan.